What up, y'all? How we doing? Looks like just got a nice little stream tonight. The goal for me, I'm going to be live every night this week to just make some space for questions, for updates. Between it seems like hour by hour things are changing. So I think it's worth it for us to kind of just carve out the time. So generally, how are you doing? Like on a scale of 10 being crazy stressed and 1 being just like a little stressed, because like I think everyone's stressed. So how are you doing on a stress scale of 1 to 10? I feel like my number changes every, hour. I'm probably in this moment right now. I don't know. I'm kind of a 3. I just kind of feel like, what are we going to do? Like, this is where we're at. And now I'm starting to like kind of point my attention towards like, how do we make the most of it? What are the silver linings? So there's that. But I wake up in the morning, I check Twitter, and sometimes it's like a 10. I'm like, what are we going to do? So generally, this is kind of an open floor. So I have, some things I can talk through about like what's going on, just general updates that I'll give you guys. But if you have any questions at all about the virus, about the political fallout, the economic fallout, the AP fallout, how schools are closing, how is this going to work? Any questions at all, like I'm here for you. So you can post any questions in the question tab. Or you can, post them in the chat, and we can honestly just spend this time talking about whatever you want. So it's kind of just a little bit of open space. Before I jump into questions, I just want to let everyone know that everything on Fiveable is free. All the live streams like this one, all the slides, all the replays, you can come in and watch anything. So general update on AP exams is we still don't know. It sounds like we're going to find out more information on Friday. They seem to be like saying Friday, March 20th is when they're going to announce more information. So I don't know if they're going to announce like the actual, this is what we're going to do, or if they're going to announce like steps towards a decision. I don't know. So generally we don't know. But as of right now, APs are still on. They're definitely looking into an online solution because realistically, I don't think anyone's going back to school. Like, realistically, I think you kind of start mentally preparing for that like you're on summer break. There's no way to know that. This could be cleared up in a few weeks. Who knows? But just the way that things are going right now, the way things have played out in other countries, just kind of comparing the stats, the data, I think it's going to be a little while before things feel like they're going back to normal. And it may be a long time before they truly go back to normal. So there's that. So let's answer some questions. All right. How long is this quarantine going to last? Yeah. So I don't know. I don't know how long the quarantine is going to last. I think a lot of this depends on our ability to be proactive. And unfortunately, we've been missing some of those windows. The very first case of COVID-19 in the United States was like January 20th. So we don't really know at this point, because of a lack of testing, how widespread it actually is. More than likely, there are tens, if not hundreds of times more cases than we know. And so we're not really able to predict right now because there's just the list of unknowns is just too much. I listened to a podcast that's called it's a 538 podcast, and they are like really big on data, and they specifically focus on politics and sports usually. But they were kind of talking about in the episode yesterday how to possibly predict this. How do you put together a data model on a virus that is totally new, right? It's like we have no idea how it's going to play out. And so, I think like there's just like these huge questions around like how people are going to, how governments are going to act, how people will react to those different policies, how people will just act on their own, how the virus itself will spread, like so many unknown questions. So we really don't know how long the quarantine is going to last. But at this point, I'm trying to mentally prepare for like 8 weeks. And I think that is optimistic. So I think it's going to be a little bit of time before things go back to normal. And as Evan said, even 18 months is a possibility. So I don't know. This is basically a live stream of me not answering your questions. Let's see. How much of this sudden influx of traffic do you anticipate will be return students? What you mean? The actually traffic of Fiveable? I mean, our traffic's been crazy in the last few days. I mean, I think that right now, we don't know about AP exams. And so we're getting a lot of students right now because as far as we know, AP is continuing. But even if AP this year doesn't happen or for some reason falls apart, it'll happen next year. And, we're not going anywhere. So I think the way that we're thinking about it is if we can talk to more students this year, if more students know about Fiveable, can come hang out with us in a live stream, can use our resources, then hopefully they'll come back later too, That's kind of what we're hoping for. Are we going to continue to do updates on Fiveable? Yeah. So I love talking about politics and economics and stuff. Normally we have a group of students. Fatima is one of them, and they are usually live on Monday nights talking about updates. And so I just decided to add this stream every night this week because I think that this week in particular feels like kind of a pivotal week. At the beginning of last week, we weren't all on the same page about this being an actual big deal. By the end of last week, then we started to see school closures, all these things changing, everything kind of starting to shake out, right? You sort of had the group. It's kind of interesting thing that's happening right now. You have typically Twitter is kind of, it always feels like it's like not real life, right? It's like Twitter is happening and freaking out, and all this panic might happen on Twitter. That happens all the time. And so I think that people that use Twitter, people that listen to different podcasts that are just super tuned in, knew that this was coming. They were watching China, they were watching South Korea, they were watching Italy, and they kind of knew this is about to pop off. And I think last week was sort of the crossover where you had everybody kind of had the one friend, or maybe it was you who was I don't know, I think this is actually going to be a big deal. And now everyone's kind of on the same page of okay, we're actually going to have to make some big decisions here. So, this week in particular, I think by the end of this week, there's, even we're 2 days into the week. And at this point, there are several schools, way more schools that are closed. A lot of states have closed entire schools indefinitely. I just found out Wisconsin, where I am, is the schools in Wisconsin are closed indefinitely. And sorry. So the schools in Wisconsin are closed indefinitely, and other bars and restaurants and a lot more is just closed. And so it's almost like the NBA and March Madness last week was kind of the turning point, right? Once you see the sports are ending, then I think everyone's kind of yeah, this is real. So yeah, so we're going to continue to do updates. We'll do updates, throughout this week. After this week, we'll definitely be live every Monday night with current event updates, and we'll add in updates as we need to, kind of waiting to see how this shakes out. Uh, how should we get food without risk of infection? Are stores doing deliveries? It's a super good question. So I think that um you can leave your house, like you right now, like we need to kind of like stay distance from each other as much as possible, especially in big groups. But you got to go get supplies, you're going to need food, medicine, the basics. And so it's okay to like go and get those things, at least, for right now. Everything is still open. We don't want to panic. We don't want to go like buy everything out. I mean, ultimately, like, we're all in this together. And so so there will be solutions. There will be deliveries, stores themselves, but every business kind of has to shift, like um they're all gonna every small business is gonna have to really think about, like, if I can't get foot traffic, if people can't come into my store, how will I continue this business? A lot of businesses won't survive, but a lot of businesses will find ways. People innovate, they find new solutions. So my guess is that a lot more stores will do things like deliveries. We'll have ways to go inside by keeping like how many people are actually in the store limited, or keeping certain hours. There's a lot of different ways that they can get through this. So I think, right now I'm not trying to be worried about whether or not we can go and get our supplies that we need. Don't feel like you have to stockpile the whole world for a year. Get what you need for a week or two. That's how you can kind of get prepared. And then we were going to kind of figure it out. How am I doing? I mean, I think pretty good. I don't know. I've been kind of going back and forth. I was kind of part of the first wave of like early last week of like, I think this is going to be a whole thing. And I was actually home with my family in Boston. And I don't know, I think I was just trying to convince them all, because they were all like, calm down, Amanda, this isn't going to be a big deal. And I was like, I think it is. And so I've been kind of processing this now for, a week-ish. Obviously, it's really heightened in the last few days. And I think there's just still such big questions around AP and what students need, just like all of it. So generally, I'm doing fine. I think the biggest thing, and this is what I'd love to hear from you guys, what are you doing right now to practice self-care? What are your like go-tos where you're like, when you just like need a break, you want to stop thinking about all this stuff, anything important, when you just like need a complete break from all of it? Like, what do you do? What is your strategy? So for me, I got a puzzle and I really like doing puzzles, but it is so hard. I got the hardest puzzle ever. So now I need like a break from it sometimes. And then I also just got an Xbox, and I am not a gamer, but I am gonna create some gaming nights that you can like play me on things. Maybe Tom will jump into, I don't know what games. I literally just learned, I just got NBA 2K20 and Rocket League, which I've seen my brother play before, so I kind of know that one. But I'm like a brand new person when it comes to Xbox especially. I played like PlayStation in like, when I was like 12. So my go-to games then were Tony Hawk and Crash Bandicoot. So I'm definitely gonna get those because I think that they still exist. But that's what I'm doing. So I'm just trying to find ways to just kind of, I don't know, calm down, do some fun things, like it could be worse, like I think I'm just trying to remember some of the things that I have that are a lot of privilege. And so I don't know, I'm just trying to connect with a lot of family members and see what it is. For sure. Anyways, let's see. So some of you guys, you're doing writing. Nice. Stay off social media. Yeah. Music, books, drawing. Yeah. Like I think these kinds of hobbies are going to be just like everything, you know, like I've been really trying to think about the silver linings from all of this. I think we're all going to get to spend a lot more time with our family. And that's kind of awesome, you know, like there is like a little bit of a slowdown that's happening that is kind of nice, even if there's still stress and panic. Like we're spending time with people. I'm calling people more. I've like picked up the phone and called my family and my friends more, texting people. I just checking in. Like I highly recommend that. Just text some of your friends or some of the people you haven't talked to in a while, cousins, you know, whoever, and just check in on them. Hey, how's it going? How you doing? I think that's going to happen more. I think we're going to have, I think generally like as a society, like I'm not sure if things will go back to normal. So, you know, how will we get through this type of recession? I think there's kind of some opportunities in it. So think of it this way. There are several House Democrats that are proposing like essentially universal basic income. I mean, even like Republicans are too. Like Mitt Romney just said everyone should get $1,000 a month. When Andrew Yang was on the campaign field, you know, promoting universal basic income, people were like, oh yeah, that's a pipe dream, you know, like that's never going to happen. That sounds like a good idea, but that's never going to happen. And now we're like possibly like days away from it passing, you know, like I think that generally a lot of the issues that we're going to see right now kind of existed before. This is just going to really heighten them. And it's going to force solutions way faster than we thought. I mean, think about your schools, right? Like how many of your schools and teachers were ready for online learning? We're tech enabled. We're actually ready to be like, here you go. Everyone's home. Now we can be okay. Not many, you know, and now I think a lot of schools will be. The fact that AP exams aren't tested online already is like questionable. The fact that there are students without Wi-Fi, without phones, without access to computers is ridiculous. You know, so like all of these factors at stake that show how inequitable our society is, all seem really solvable all of a sudden. You know, it seems like Comcast or Verizon or AT&T just blanket the country with Wi-Fi. I don't know. Can we do it? If we have to do it, figure it out, you know? So I'm trying to think of like some of these solutions that just like might come up. Netflix party sounds awesome. I've even been like FaceTiming my friends more. We never did that. I don't know. It's just like cool. Do you think it will get to the point where the government forces people to stay in their house? I think it could. I don't know if we're there yet. Because the problem is like the US is far bigger than Italy, right? And the other thing is that like we are, you know, we have a federal government and then we have state-run governments. And so right now the states are really kind of making decisions one by one. It's almost like there's 50 little countries in this country. So in Italy, it's a little bit easier to just kind of blanket something like that. Whereas in the US, it's a little bit more difficult. It could happen though. You know, we're not there yet. Right now, we're sort of hoping that people opt to do the right thing, which is just staying home. But I think it's going to depend on how fast things ramp up, how fast cases ramp up. One thing to note is that in the next few days, you're probably going to see the number of cases in the US like increase very quickly every day. So it's not that there is an exponential growth. So cases are actually going to be increasing fast. But right now, in this moment, especially in the next week, more testing will happen. So as long as we're testing more, there's going to be more positives. So don't freak out if you see the graph just like going crazy. Like that's an effect of just testing more too. the number of cases is already exponentially growing, and it's far bigger than we know. So I think just like keep that in mind so that you don't panic. Things to do to keep family from fighting. How many people are live in your house, Liz? How many people are you with right now? 6. Mostly siblings, or do you have grandparents there too? I think the main issue, yeah. 4 siblings. Wow. Well, I think y'all are gonna get really close. I mean, I don't know. I think everyone's kind of dealing with just like a whole new system. So, like even people who are, I mean, stress is really high. Everyone is very stressed out, very anxious. And that leads to conflict. I think that's really the heart of it. And so I think the main thing to do is to just really try to practice self-care, and for each person to do that. And just like be like communicating those things, like stress is just really high. And so the more that you can just like talk to each other about how you're feeling, about what's going on, what you're worried about, the more you're just sort of like processing it together. And just like finding things to do too that can kind of, build the relationships, but without having anything to do with this, play a game together, which for me and my brother, that always ended too. And just, boards going everywhere. My parents won't let me near my brother because of the virus. Yeah, that's really hard. I know some houses are being kind of quarantined within the house. I think still the best thing you can do is just find ways to just like to work together, to be on the same team. It's like it's just kind of us versus the virus, and so obviously every family is different, and every house has different context, but I think that's just the biggest thing, is just to like really try to be there for each other, and just know that like you're super stressed out, and so are your siblings, and so are your parents, and every time they might not be communicating that they're stressed, they are, and so just trying to really understand each other, and like just like being supportive. I don't know. That's like the best advice I can give. I know that's not really very concrete. It sounds easier than it is, but that's my thoughts. This question, do you feel like this is being over addressed or under addressed? Okay, so last week I thought this is being under addressed. I think right now we're kind of in the shift from under addressed to just right. It's definitely not being over addressed. I think if anything, we are not doing enough. But everything that is happening is right. Every closing, everything, every decision that's being made right now that feels so dramatic, it's the right thing to do. It's like the perfect amount of addressing. Because really the advantage that we have right now is that we are 10 days behind Italy, that we're behind South Korea, we're behind China. And so we can watch what's happening in those countries, what they're doing, what's working, what's not working, what are the consequences of different decisions. And we can then make better decisions because of that. So what we know right now is that social distancing works. It just works, right? The big thing right now is flattening the curve. So have you all seen that curve? Or do you want me to bring it up? But I'm sure you've seen it, but it's basically like, actually, let me pull this one. Okay, let me stop that question. Let me pull up this one. Okay. Okay, so this is the curve, right? So the whole idea is that all of these measures, the distancing, the isolation, the quarantining, is all about really like trying to allow the health care system to not get overwhelmed. So the whole point is, if we can you see this? Yeah. If we do nothing, then people are going to keep getting this at an exponential rate. At some point it would still drop off, but ultimately there are only so many hospital beds, there's only so many ventilators, there's only so many doctors, like doctors and nurses who are working in hospitals and healthcare facilities. They can get sick too. They will get sick too. They're also just humans. They can only work so many hours during the day. And so the more pressure we put on the healthcare system, the more difficult decisions are going to have to be made, where there could be two people that are sick, and if one of them is more likely to survive, they're going to get the ventilator. Like for a doctor to have to decide who lives and who dies, like that's worst case scenario. Nobody wants to be in that. So ultimately it's really about flattening this curve, right? So the way that you flatten the curve, the same number of people are going to get sick. We've seen estimates of anywhere from as high as, a lot of people are probably going to get this, but the main thing is to let them get it over time so that no matter what, the hospitals have space. So hand sanitizers, and so the best thing that we can do, basically the best protective measures that we have are, one, just completely distancing ourselves, right? So not being in big groups, because as soon as we are in big groups, if one person's infected, even if they don't have any symptoms, they can spread it to a lot of people. So in South Korea, they basically had stopped it after 30 people got it. They had really kind of stopped it. The 31st person that got it, she didn't take it seriously. She went to the hospital, and then she left the hospital. She went to a hotel. She went to a church. There's a little map of all the places that she went. And that one person ended up infecting 1,000 other people because she kept going to these big areas. So the main thing is to isolate, because ultimately, like, especially young people, it's likely that many of us will get it if we don't already have it. And for us, it's not going to be that big of a deal, right? There are 20-year-olds, there are kids that are getting very sick too. It could happen. It's not that anyone is kind of immune from it, but it's not necessarily the whole point is that, like, you could have it, someone could have it, and if you go into a restaurant or a grocery store and you start touching other things and you didn't even know you were sick, and then folks who are, like, more high risk, they're older, they are immunocompromised, they are, dealing with other types of issues, then they're going to get super sick, right? And then if all these people go to the hospital at the same time, then we can't actually care for all of them. So that's the one thing we can do. The second thing you can do is washing your hands. So you are going to leave the house. You can go outside, you can go to the grocery store. If you are going to do those things, the idea is to avoid doing them as much as possible. But if you have to go out and get something, wash your hands before you leave the house, because, it keeps it clean. Then wash your hands as soon as you get back. Wash out everything that you touch. It's just keeping it all clean. Obviously, the hand sanitizer stuff has popped off because people freaked out and bought a lot of hand sanitizer. To be honest, washing your hands with soap is just as useful. Like I have a little like hand sanitizer thing here that, it's probably worth thousands of dollars now. And I can, use it, but I'm home. I can also just wash my hands. So it's not that big of a deal. So just keep washing your hands like so many times during the day. And when you do it, you're supposed to do it for 20 seconds. So either count to 20 or sing happy birthday to yourself, or do something else to kind of pass the time so you know how long it's taking. So this is it. This is the curve, right? This is the thing in the 2050 DBQ. This is the document, like for sure. One thing I saw that was today, this is the kind of graph that makes you feel like we're under addressing it. So look at this graph for a minute. This is, I believe, in the US. So this red line here is the bed capacity in hospitals. And then this is the guess. This is the estimate of what could happen for each type of like how intense our supports get. So this top one, the black line here, is if we did nothing. If we just did nothing, we just kept going as we were going. This is how intense this could happen. This could be, right? So obviously we're past that. We are already doing things, so it's not going to be that. The green one here is if you just close schools and universities. Okay, we make it a little bit better, but not a whole lot better. Then the next one is if you isolate anyone that is feeling sick, right? If you're feeling sick at all, you have to be isolated for 14 days. Okay, we're making it a little bit better. The next one is that you also end up quarantining within the house. The next one is that you would, what's one down here? That you're isolating in the house, that you're quarantining people from home, and we're also making sure to distance ourselves from people that are over 70. So, this is a little bit stressful, right? Because I think then I just wonder, well, what do we do to flatten this even more? Because we got to get this down as far as possible. So it is what it is. All right, let me click out of that. All right, I got 4 more questions here. All right, do you think the US is doing enough to flatten the curve? I think some states are. There are a lot of states that are not closing schools indefinitely. I'm not sure every school is closed right now. So that's a problem. There are some places like we should be closing bars and restaurants and movie theaters, theme parks, beaches, anywhere where people congregate. We should close those. Like churches and religious centers should move to online services. People, of course, want to connect. They should be able to connect, but they shouldn't go to in person to do that. So there are some states that are doing better jobs than others. Some states are really falling behind, and that's scary because each state kind of has their own curve, right? You can flatten the curve in, Wisconsin, but if Illinois is not flattening the curve, then it's not going to make a difference because people go between Illinois and Wisconsin all the time. So that's the problem. Do you think the virus will ever go away? Yeah, I don't think so. I think that this virus is now here. And it's just right. It's just like the flu or the common cold. Like there's plenty of viruses that we deal with that happen, that kill a lot of people every year. Like these are just things that are part of life. So no, this virus is not going to go away, but we will get a vaccine. It will take some time, but we'll get one. And we'll be able to limit it, So it's not that we're going to have to live like this forever, but coronavirus will be part of our life from here on out. It will be a factor. Just like the flu. Will autoimmune diseases make us more at risk if we have one? Well, the problem is just if you have if your immune system is not the strongest that it could be, then it just means that you could be more likely to get the virus. And if you get it, then it could affect you more. So, if that's you, if you fit into that, you just need to talk to your doctor in order to get like medical advice. Like I don't know you, I don't know exactly what it is, but the best thing you can do is just talk to your doctor and social distance, just stay at home. What if I have it and I spread it to my baby sister? So the really interesting thing about all of this is that babies seem to be like not affected by it. They can still get it and they can very much spread it. So the bigger issue is that chances are your baby sister, if she were to get it, would be fine. The bigger problem is that she is more likely to spread it to the rest of the family because babies touch their face all the time. They lick things. They're, they just are they're always kind of sticky, And so if she kind of spreads it around, then that's the bigger issue. But just keep washing your hands too, even if while you're at home, It's the only thing you can do. There's no way to know. All right, are we sufficiently stressed out? Are we more stressed or less stressed than when you started tonight? I don't know how I'm feeling. Less stressed? That's good. A little less. I mean, here's the thing, like this is a moment that we are all going to remember. Like when 9/11 happened, I was 12. Okay, so, and I will never forget that day. Like that is the only thing that I can relate this to. But this is different. This is global, and it's not like a one-day massive thing. It's like an enemy that we can't really pinpoint. We can't see. And so there's definitely layers of this that seem worse in a lot of ways. But it's just it feels unprecedented, Like I talked to my grandmother yesterday and was like, have you experienced anything like this? And she was just kind of like, the only thing that she could pinpoint was polio in the 50s and being afraid to go to the beach, and AIDS in the 80s. And when people really didn't know how it spread and what was happening, there's that fear. And so, but she was basically like, this is like nothing she's ever seen before. And she's 80 years old. So I think we all kind of have to just sort of be in this moment together and, just pay attention to it. Start writing down your experiences. That's one of the best things I heard. Get a notebook, get a journal, open up a Google Doc, and like every day, or literally open up I have a note on my phone that I'm just like keeping every day. Just like put a couple of bullets of just like, how do you feel today? What did you see change today? More schools closed today. If you saw anything else that happened, how is your family doing? Just kind of keep track of it day over day. And, in the future, your children will ask you about this. And for you to be able to say like, here's my like journal, it's your primary document, I think is kind of a cool thing. And it keeps you really grounded too, because you'll be able to remember how you felt each day. So my hope is that we are all very stressed out right now because it's new, because it feels like a lot of unknown. And that as we go on, we're going to get more and more used to this. We're going to see a lot more creativity. People are going to get really creative in terms of businesses, in terms of art, and just keeping people engaged. You're going to see some really amazing things happen in the next few months, especially as we just have more time. People are going to create a lot of really cool things. And you can do that too. You can be a part of that too. So I think you kind of have to just lean in and just know that like, yeah, things are going to not be the same for a little while. And the end of your school year is not going to go how you thought it was. And your summer might not go how you thought it was. But other things will happen that are good. And, that keeps me going. So, any last words of advice? To each other, to me, and then I'll break for tonight, and I'll be back tomorrow night, same time, same place. Just kind of giving space to ask questions, keep asking questions. By this time tomorrow, there could be updates on things. We don't know. So, yeah, I just think it's nice to just come together, you've got a lot of questions, and you should know that you're not alone in how you feel right now. All of the stress, all the things that you're dealing with at home, with your family, with your friends, with school, everyone's feeling this too. And I think that's something that you can sort of, I don't know, that's never happened, right? Normally you've got one set of things going on, your friend's got another set of things, your teacher's worried about something else. Right now, in this moment, we're all worried about the exact same thing. So, I take some comfort in that too, because at least what's keeping me up at night was keeping a lot of people up at night. Yeah, the adults are also freaking out too. But I think what I do to stay in the loop is I follow a lot of news sources and different people on Twitter that really keep me informed. I listen to podcasts. I've been watching the news more, just sharing things. One of the things to watch right now is, in terms of that universal basic income, is that one of the things that's being proposed would essentially send every American adult $4,000 to make it through this, and then an additional $1,000 per kid. So there could be relief. There could be things that are coming our way. So it's something to just keep a lookout for, because it could be really helpful for a lot of people. I was just saying, if that happens, I'm going to end up, maybe being able to put it towards my student loans. Who knows? All right. Well, yeah, $1.5 trillion. Yeah. The idea that the whole bailout of businesses of just corporations is so stressful for me. It's so frustrating to watch, especially when the airline industries, the last time they were essentially bailed out, they ended up using most of that money to buy their own stocks, which then just drove up the prices. And that's not what you want. So, super no. So I'm very hopeful that some stimulus package will be passed for people, because here, silver lining again, the fact that there are Republican senators and Republican people, Congress people, that are offering up solutions that include stimulus packages is a really good sign. So that means that some type of bipartisan policy could be passed. And honestly, a few weeks ago, I would have never thought that could happen in this current political state. So the fact that we're even skirting around it, that it actually seems possible, is wild. And I hope that they propose the most progressive way of fixing this. Think as big as you possibly can about how we support people and small businesses through this, and propose that, and then we'll see what happens. This question about, should extracurriculars be canceled? Yes. It kind of, I guess it kind of depends on where you are and what it is, but yes, I don't think that there should be more. We really shouldn't be gathering, is kind of the point. So if the extracurriculars are including groups of people in one place, then they should be moved to remote. Meet with the clubs remotely. If there's sports or drama or anything like that, they should be canceled. If they're not canceled, then I wouldn't go. I keep telling my mom, her work has not been canceled. And so she's been going into work. And every day I'm just like, stop going into work. Like, you need to talk to them. You need to tell them, because in a few days, they're all going to be canceled. But things are going to spread just as much today as they would have in a few days. So the more you can just pull all the way back, the better. All right. Well, this was fun. It's, nice to just kind of hear your questions and whatnot. So I'll be live again tomorrow night. Tell your friends, post it around. And Fiveable is here for you while we're all just kind of dealing with this together. So stay healthy, stay sane, keep, take care of yourself and your people. After this, like, choose one friend that you haven't texted in a while and send a text to them and just ask them how things are going. Because like I said, like, everyone's dealing with the same exact thing. So it gives you the perfect way to reach out to people that you haven't talked to in a while. And they'll really appreciate it. So do that. That's your homework for tonight. Text someone that you haven't texted in a while and just ask them how they're doing. All right. I'll see you guys later. Bye.